What is a consent? So, consent is a contract. It is a legal contract between who and who? Like, what is the contract between? Like, who is undergoing the contract? It is between the doctor and patient. Okay, this is the thing. Okay, the consent is the legal contract between the doctor and the patient. And to call something as a valid consent, what are the components that we need to have? Okay, if you want to say a legal contract is existing between the doctor and the patient, and to prove that it is a legally valid consent, what are the points and the components that we need to have in the consent? First, it should be informed. Okay, you should fully disclose. Okay, you should fully disclose the thing, like whatever treatment that you are going to do, whatever diagnosis modality that you are going to use, whatever you are going to do, you have to fully inform them. Okay, you just can't say, like, if a patient is coming to you for some sort of infection, like he is having a common cold, okay, and if you are giving him some high-end antibiotics, you can't just simply give him without saying anything. Okay, you have to explain him that you have been diagnosed with common cold, and normally what the antibiotic that they prescribe is different, but I am giving you a high-end antibiotic, and why I am giving the antibiotic is the reason is this. Like that, you have to fully explain the thing to the patient. And even after listening to all the things, like all the information, all the positive and negative aspect of the treatment and the diagnosis that you are going to do, and if the patient is giving consent, then only that consent is valid. Okay, this is mainly implied in the case of surgery. Okay, so if you are going to do a surgery, let's take a thyroid surgery. A patient is suffering from CA thyroid. Okay, and you are going to do a surgery on him, like you are going to do thyroidectomy. Okay, and before doing thyroidectomy, obviously you will get the consent from the patient. Okay, and doing the consent, or like what will you write in the consent? You have to write in the language that is known to the patient, that is patient's own language. Okay, patient own language. Okay, you will write. Okay, and what all you will mention? That you are having CA carcinoma. It is a deadly condition. Like you cannot say that, like you cannot say all the prognostic percentage, all the complicated medical terms, you should not bring in. Okay, it should be in a layman term. Okay, it should be in a layman term. Okay, and you should address directly. Okay, you should not have a mediate. Okay, if you are going to do surgery, you should not send your nurse. Okay, you should directly go and explain the things to the patient, not the patient's attendant. Okay, you have to explain it to the patient directly, and you should be clear. Okay, you should be clear. You should not like just confuse things. Okay, you should be clear. You should explain the things for as it is. Okay, you will say that he is having a carcinoma of the thyroid. Okay, and it is a deadly condition, and what the doctor suggests, what the doctor thinks is that a thyroidectomy, that is removal of the, you should not write thyroidectomy in the consent. You should write, I am going to remove the thyroid. Okay, removal of thyroid is what I am suggesting depending upon your condition. That is the best mode of treatment available now. Okay, and in the surgery, like during the period of surgery, there is chances for hemorrhage. There is chances for injury to the certain structures which will affect the normal way that you live. Okay, his recurrent laryngeal nerve might get injured, his voice may go, so like that he might suffer some injury. Okay, or sometimes he might get hemorrhage and he may also die. So you should explain all the things, all the negative things that will come because of the surgery, all the risk that involves in the surgery, and what are the things that you would do to prevent all those injury. Okay, you would say everything in detail in the consent form. Okay, and and that patient, he should be able to understand that consent. Okay, he should have a clear mind. Okay, intelligent enough to understand that, whatever you are conveying to him, he should be able to understand that. You cannot go and say I'm going to remove your thyroid to a 5-year-old children, right? Or you cannot go say this to a person who is mentally challenged. Okay, so he should be an intelligent, someone who is able to understand what we are explaining. Okay, so even after doing all this thing, if the patient is saying, okay, I am consenting for the surgery, okay, without any external pressure, he should be completely free. You should not pressurize him. You should never pressurize him. Okay, you should give the choice to him. You should the autonomy of the patient should be respected. Okay, even after all this, if he gives consent for the surgery, then only it is a valid consent. Okay, clear? So what is that? It is a informed consent, and it should be in patient's own language, and it should be clear. It should be in layman's term, no complicated medical jargons, and it should be directly addressed to the patient, and the patient must be intelligent enough to understand what is he being addressed into. Okay, and if in such cases, if it is the children or if it is a mentally challenged person, you could convey this to the guardian. Okay, so and he should not be pressurized in any way to give consent. Okay, after fulfilling all this criteria, if he is giving consent, then it is called a valid consent. Okay, clear? This is how you should ideally take a consent. Okay, so next time when you are going to take a consent, will you follow all these things? Okay, you should better. Okay.